www.DesiBlitz.com.
I'm Mr. Mabroor Bhatty. I'm a plastic and hair transplant surgeon. You are watching me on DesiBlitz.com. I was involved with plastic surgery right from the start. When I was doing hair, in my graduation time, in my medical college. Then I did when I was doing health job. And later on, during my training in UK, I was involved with plastic surgeons. I wanted to do orthopedic to start with, but I wanted to just have a taste of plastic surgery, and once I went in, I never came out. So it's just the type of work that you can do, a mixture of reconstructive work and a mixture of cosmetic work, and that really inspired me. In cosmetic surgery, it's in men, hair transplant is very popular. They like to do liposuction as well, and tummy tuck, especially those who have lost weight. They like to do that. Nose job is also quite high in the list in such people. In women, again, hair transplant is not uncommon actually, but it's liposuction that they want to have, tummy tucks. Again, nose job is also quite popular. We inherently tend to have slightly biggish nose or hooky nose. So some people, if you don't like it, that can be helped as well. My cosmetic day, where I do cosmetic surgery, so we start 8:30 in the morning, and we've got 4, 5 or 6 patients or whatever, and you perform that. So by the time you finish that, it's normally 8 hours, 6, 7 hours, and you're very tired to do anything else really, because it's a very fast track system where you can have a couple of breast augmentation, 1 tummy tuck, maybe eyelid surgery or whatever. I do all range of cosmetic surgery, but it's different when it's a hair day. In other words, when you have to do hair transplant surgery. Hair transplant surgery, typically you cannot do more than 2 procedures a day. If it is a big surgery, over 1,800 to 2,000 follicles, 2,500, 3,000, 3,500, you can't do more than 1 surgery a day. Men get it mostly, and it's because of none of their fault. The only fault was that they belong to that genetic group where they've been losing hair in the family. You can actually give their hairline back, and you can give reasonable hair density to them, and that if it's done nicely and properly, giving natural hairline, it's a life-changing experience for them. Similarly in women as well, it is not as the results are not as robust, but in many women where you are losing hair, it becomes a social problem, and so it's not really acceptable in any society to have a bald or thinning head in a woman really. So it's a fantastic procedure, a well-rehearsed procedure, and gives consistently good result. It is. I mean, when I came into plastic surgery, that was in 1991. Because I have practiced outside UK as well, in Asian, and have worked with Asian people a lot. So breast augmentation is getting popular, both abroad in Indo-Pak and also in the UK. And more people are actually having it done. I've just seen today middle-aged woman wanted to have it done. So it's not even age related. It's when they feel is the right time for them. So all ages of people and all ethnic society of people, they come, and Asian, it is getting more and more popular. On a normal breast, which has never been operated upon, I've gone up to 750 as well. They are generally tall, big girls, and something which they can take it. You have to be very, very careful when you put big implants in, because big implants mean bigger complications. In the excitement, people have it and the surgeon will do it, but these are the people who may have problem with sagginess of the breast in the future. They can change position and shape and size. People don't realize that it's a constant weight on the shoulder and the constant weight on the back, which over a period of time they find that they start to get chronic pain in the back. They go for all sorts of different to different surgeons for the treatment, and it turns out to be it's their heavy implant. And it is therefore very, very important that once you take that and make that decision after seeing the patient, consulting the patient, explaining pros and cons, and when you yourself as a surgeon satisfied that the build of the patient can take that, then do it. I don't think there's any role of surgeon to accept anything what the patient demands, especially in cosmetic surgery, because one has to be very sensible and responsible about it, that what you advise the patient should be in the long-term interest as well. If you get it done over there by anyone, first of all, you may not know the surgeon. You probably have to go and see the surgeon there, and by the time you reach there, you are committed already, whether you like it or not. Then you have to have a surgery. Yes, it may be half-priced, less than half-price, but don't forget that you have to spend another £1,000 to go there. And once you have done that, then you have to have your stitches out. By the time you come back, and if you have a complication, then you wouldn't know what to do. You can't go back. If you go back, then another £1,500, and the hassle that you had at the end of the day, it is there if you like it, whether you like it or not. Sometimes there is an issue, especially with hair transplant, with the infection, because there it's done in the clinic setup really, and the sterilization is always an issue. And in places where you got hepatitis B and C and HIV so rampant, one need to be careful with that. I'm not saying don't have it done over there. What I'm saying is that you have to be careful. Advantage here is, yes, you are here, it's expensive surgery, but then put your money together. These are the surgeries you don't want to have it on daily basis, you have it once in a while or once in a lifetime. So advantage is you don't have a problem. You have seen the surgeon. If you like the surgeon, then the place, you get it done. And God forbid something goes wrong, you can always refer back to the surgeon and you can get things corrected and get things done. So there are advantages of that. Yes, you pay a bit more, and then the problem of infection, that's not there in this country at all. Most of the instruments are throwaway instruments. So there are a lot of advantages of getting it done. The only disadvantage I can see is that of the cost. And I think that by the time you have gone and come back, you probably be saving not more than £1,500 really.